What are the bends? So when I'm talking about the bends, I'm talking about decompression sickness, which occurs when scuba diving. The bends is just the common name for this. But decompression sickness is basically, it is a medical condition that can occur if you scuba dive wrong. And by that, I mean, what is going on when you're scuba diving is you are going to depth. And when you are at depth, there is a lot of pressure upon you from all of this water on top of you. And so when you're down at this pressure and you're breathing compressed air, in this air, there is mostly nitrogen. Actually, sorry, a little tangent. I don't know if a lot of people know this, but the air in the atmosphere is only about 21% oxygen. The rest is nitrogen, about 78%, and I think there's about 1% of argon. But mostly air is nitrogen. And so what happens when you're breathing this compressed air at a pressurized depth, there is nitrogen and oxygen and argon going into your bloodstream. However, with a sudden pressure change, say you rocket to the surface, the nitrogen in your bloodstream can expand and cause little nitrogen air bubbles. And it's kind of like, you can probably associate it with opening a can of soda, right? There's a sudden pressure change when you open this can of soda and it causes fizzing and bubbles. That is happening in your bloodstream to a maybe smaller extent, but whatever. I think it's a good analogy. But in your bloodstream, now you have, if you rocket to the surface and there's a drastic pressure change, only if that happens, these little bubbles will form and it can cause joint pain, or even in severe cases, it can lead to bubbles in your brain and cause a stroke, and it can cause death, but a lot of the time it doesn't. And when this happens, it can cause to extreme joint, pain. It's very painful. And so they call it the bends because people would bend over in agonizing pain. They coined this term back when scuba diving was first beginning, and they didn't know really what they were doing with decompression sickness or how it worked. And so they call it the bend. You got bent, you got the bends, right? But however, this doesn't always happen. And it doesn't always happen because we are now informed and we are good scuba divers that follow dive tables. And dive tables are little charts that tell you how long you can stay at depth without having a decompression stop, or while having a decompression stop. And decompression stops allow you to have the nitrogen will flow through your system, and you will actually breathe out nitrogen as you ascend slowly from your dive. And so if you ascend really slowly, about 30 feet per minute, so half a foot a second, and then also if you're really deep, you have to have a decompression stop, which is basically you will just stop at a certain depth for about 5+ minutes to allow your body to work through this nitrogen. Okay, and if that happens, you're gonna be totally fine. Okay, but you have to follow these dive tables, especially if you are doing repetitive dives one after the other. Now, if you have decompression sickness, sometimes you just have to breathe 100% oxygen, no nitrogen, 100% oxygen, and you'll be okay. Or in severe cases, you have to go to a hyperbaric chamber, and that hyperbaric chamber will basically mimic going back down to the depth that you were at, and it will then slowly release the pressure of this hyperbaric chamber and allow you to have the nitrogen flow through your system properly. Or you just be a good diver and follow your dive tables. But yeah, that is the bends and decompression sickness. But we don't get that because we're good divers.